Hey, hello friends. Welcome in podcast with Dr. Priyanka and also in the video. Today in this podcast, we are going to listen about the common laboratory investigation. And the investigation today we are going to listen or see is the CBC, that is complete blood count, also called as hemogram. So kindly stay tuned. So what are the indication, guys, when we'll call for CBC? First is when there is suspected infection. So if the patient is coming with repeated fever or to know the source of infection, we'll call for CBC, which is the first and the prime investigation every doctor needs to advise his patient. Second is evaluation of anemia. If the lady or the person is looking pale, if we look for the conjunctiva, if we look for the nail beds or the overall appearance, if you are finding it is pale, so for the evaluation of anemia, we need to do CBC. Third is in suspected bleeding disorder. If the patient is having continuously hematemesis, hemoptysis, that is blood in sputum, vomiting of blood, that is hemoptysis, or melena, that is if there is internal intestinal bleeding, there will be black stools called as melena. Then suspected malignancy in such as leukemia, that is blood cancer, or lymphoma. And the last is suspected bone marrow failure. So these are the basic and important indication, guys, where CBC is mandatory. Then in the reports, so when the report comes in a hand, what are the parameters mentioned? First is TLC, that is total leukocytic count. Second is differential count. Third is hemoglobin levels. Then fourth is MCV, that is mean corpuscular volume. Then it comes RDW, that is red cell distribution width. This test is actually a measurement of the range in the volume and size of your red blood cells. That red blood cells actually move oxygen from your lungs to every cell in your body. So with that ratio, we are able to calculate whether the body has the ample amount of sufficient RBCs to provide oxygen to all the parts of your body or their body. And the last comes platelet count. So description of the report, guys. Like see, normal values, TLC is 4,000 to 11,000. And then differential leukocytic count, that is lymphocytes, is up to 60%. Neutrophils up to 40%. More than that suggestive of infection. Hemoglobin age-wise cutoff is available. So normally it should be like within 12 to 16. Normal range is higher in neonates. In neonates, we'll find hemoglobin 18 to 23. Okay. Then MCV, that is mean corpuscular volume. The normal range is 77 to 90 nanomilli square. Platelet count falls in the normal range of 1.5 lakhs to 4 lakhs. And the red cell width falls between 15 to 20. So how will you interpret the CBC? So see, if there is iron deficiency anemia, hemoglobin will be decreased, MCV will be decreased, that is the peripheral smear will come with the report of microcytic hypochromic anemia. Then RDW will be increased. Then platelet count will be slightly increased. Total count will be normal. RBC count will be decreased. And Menster index, that is MCV upon RBC count, will be less than 13. And this is actually needed when we want to rule out thalassemia. And the Menser index is less than 13. Okay. So if there is infection, usually total leukocytic count get increased with predominance in bacterial and fungal infections. Lymphocytes will be increased in cases of tuberculosis, pertussis, and leukemia. So these two things we need to keep in mind. In severe infections, TLC can be depressed. We can find leukopenia, that is reduced total WBC count is called as leukopenia. So in severe infection, this may happen. In viral infections, there is leukopenia is more common, such as in dengue fever and in influenza. And last, thrombocytopenia. In thrombocytopenia, basically, there will be reduced platelet count, that is less than 1.5 lakhs. And when it is severe thrombocytopenia, it is less than 50,000. So what are the remarks and questions, guys? Which anemia have microcytic and hypochromic RBCs? So the answer is iron deficiency anemia, thalassemia, and lead poisoning. How will you confirm iron deficiency? So by serum ferritin levels, that is low, which will be low in iron deficiency, and iron binding capacity, that will be high in iron deficiency anemia. Then what are the findings of acute infections in CBC? First is total leukocytic count will be raised, polymorph nuclear leukocytes and band cells are increased. I'll tell you what are band cells. How is the body structured? Like there is normally after 120 days, the RBC completes its life cycle. Okay. Even WBC also has their own life of 4 to 5 days. When there is any infection in the body, the present WBC will go and fight with the infection. The infection is so much that the prematured WBC are also needed to fight the infection. So body is continuously sending the message to provide extra WBCs. So in such cases, we get this band cells in the reports. Fine. Then another question comes is, when do you say pancytopenia? Pan is all. Okay. So when total leukocytic count, hemoglobin and platelet count are below normal levels, it is seen in severe infections or aplastic anemia or leukemia. Fine. Then what are the common causes of thrombocytopenia? So the low platelet count is seen in severe infections like malaria, enteric fever, septicemia, then malignancy such as in leukemia, then autoimmune diseases like SLE, then aplastic or hypoplastic anemia, and idiopathic thrombocytopenia, that is ITP. So yeah guys, this was all about CBC, the common investigation, the cost-effective investigation. Every doctor should know about the investigation and what is the purpose of the investigation. As the medical student, you should be aware about it. When you are posted for the outposting or for your internship, you should know the basic idea about CBC. So thank you for staying tuned. Think healthy, eat healthy, and love each other. Bye-bye.